Hello. Hello on the phone.
I'm on.
Can you hear us on the phone?
Just so y'all know, Dr. Tilson will also be sitting here too.
We're just getting set up here
Yep.
at the Department of Health and Human Services. I just
Okay,
want to make sure that you guys
I'm
can
gonna
hear
put
us
this
okay on the phone.
As well. Okay.
Now,
I only wanted my money back after she took the car away from me before school even started.
because I broke my rib the day that she quit working for me.
Yeah, because she slipped on cleaner that I had put all over the bathroom after she smeared all over the walls.
And threw her hands up that night. I broke my rib.
I don't know about the throwing my hands up, but I definitely quit.
Emotionally, she's
Sounds like a resounding yes. You can hear us on the phone.
Toll and an increasingly urgent international response.
Governor Roy Cooper also expected to give an update today from Raleigh. Any minute we are awaiting that update. Of course, we will bring you any information that's pertinent in just a few moments.
But here's what we know. According to the CDC, there are now at least 59 confirmed cases of the coronavirus disease in the United States. Those include 42 who were aboard the Diamond Princess cruise ship and 3 from China.
That number also consists of 14 individual travelers who were diagnosed in the U.S. after returning from overseas. The CDC has tested at least 445 people. For more on this, let's get to Alice Barr, who has the latest from Washington.
Fred and Vanessa, President Trump's critics have accused him of not taking the virus seriously enough, and tonight he is pushing back. Overnight in Nebraska, a coronavirus patient led gingerly into quarantine by biosuited medical personnel. The sobering image coming as federal health officials warn Americans to prepare for the possibility of a pandemic, while at the same time President Trump downplays this seriousness, blaming the media for panicking markets. Stocks showing signs of rebounding today after dropping sharply over fears of the virus spreading across Asia, Europe, and the Middle East. 80,000 cases reported worldwide. Coronavirus is highly contagious, and though symptoms are similar to the flu, it appears to be much more deadly. Roughly 2% of patients dying at the epicenter in China. The National Institutes of Health says it will be a year to 18 months before a vaccine is ready. For now, health experts say the risk in the U.S. is low, with fewer than 60 known cases.
Even though it's well contained now, what's going on in the rest of the world is making it look more and more like we will have something that either is or approaches a pandemic.
The Trump administration is asking Congress for $2.5 billion in emergency funding to prepare and speed development of a vaccine, though Capitol Hill critics say it's not nearly enough.
Too late, anemic. Hopefully we can make up for the loss of time.
The Senate's top Democrat calling for $8.5 billion to give federal, state, and local officials the resources they need. An American service member has now tested positive for coronavirus in South Korea, and U.S. officials are looking to that country as a model for how to handle it here. In Washington, Alice Barr, WCNC Charlotte.
Alice, thank you. We'll keep it here with concerns over the coronavirus. Breaking at 4, we're following here the stock market closing.
And also joining on the phone. I think when we're in a situation like this where there's a lot of fears and concerns, having really good communication and credible communication is really, really important. So thank you for the opportunity to do that and for your interest. Most of you are aware that yesterday the CDC did put out some guidance that for Americans to be a little bit more forward-thinking and start thinking about and planning for what it might look like if we had more widespread disease or infection in the United States. And some of this was spurred by seeing the spread of COVID-19 to more countries outside of China. I want to, though, again, reiterate and reassure that, again, we have no confirmed cases in North Carolina, and currently we still consider the risk to North Carolinians as very low. However, we want to be forward-thinking and as prepared and planning as possible in this time when, we still consider the risk to North Carolinians low. As many of you remember or know, that we've been already planning and preparing and working across our agencies for the past month and a half, both across emergency management, across DHHS, and then closely with our partners, our local health departments, our hospitals, our healthcare providers. We've been really proactive thinking about what might be early detection and monitoring of people who might have infections. Again, just to reiterate, we have no confirmed cases in North Carolina, but we've been working very proactively on that, what might be early detection and containment of infections. And then with the formalization of the Governor's Task Force 2 weeks ago, that took us to another step to be more forward-thinking, to do exactly the kind of things that the CDC was recommending yesterday. Be more forward-thinking. What would it look like in North Carolina if we had a case or several isolated cases or more regional spread or more widespread? What would that look like? And so we've been already working and will continue to work all those different scenarios. What would it look like? And how can we make sure that North Carolina is as prepared and resourced as possible? So we wanted to reassure people that we're already doing that in close communication. And then also yesterday when the CDC said that people should start planning, we wanted to be sure people had some really practical information on what they could actually do to start preparing now. And so things like at a family or a personal level. Again, we keep saying wash your hands, but we mean it. Wash your hands, wash your hands, wash your hands, and also don't touch your face and your mouth. That's something that's actually really hard for people, so one of the things that we are suggesting is just start noticing how often you actually touch your face and start thinking about that and helping to modify that once you know it. And then also thinking about scenarios. What might it look like if you had a family member who is home and you need to stay home from work to care for that family member? Start thinking about some of those contingency plannings. Also for our business sectors, and a lot of our business sectors have been asking us, what can we do? Now right now might be a good time to just look at your HR policies. What are your policies for somebody who might need to stay home to take care of somebody who's sick? What are your policies for telehealth? So start brushing off those HR policies and just see what you have. And then with our healthcare sector, we're reminding them to go ahead and look at your policies and procedures for infection control, looking at your supplies. So this is just a really good time in North Carolina that the risk is low to start looking ahead and being prepared. And we wanted to be sure people had some very practical strategies to do in light of CDC's recommendation yesterday. So with that, I will end. And then there's Director Sprayberry, if you have any other comments you'd like to do, or we're happy to field any questions.
Hello.
Hello.
So we traveled to Nash County today. We had several viewers on our WREL page ask, what does preparedness look like? And so we went to Nash County, spoke with a couple. They say that this, getting prepared is pretty vague. And a lot of these families want to know, what exactly does getting prepared look like in the event that a pandemic does happen?
Right, and so that's exactly what we're trying to do, is give people really common sense things of what they can do right now. So for an individual or a family, exactly the things that I was saying. So one, really good hygiene. Washing your hands, starting to think about how often you touch your face. Really, really important. And then again, think through if you have a family member who's sick and you need to stay home from work. Really very practical strategies on a personal level. Those are the things that people can start thinking about to get prepared now.
Is it worth going to the store, buying all these extra supplies, hand sanitizer, face masks? I mean, people have said these face masks have been selling out. Is it really worth all this?
Yeah, let's talk about face masks, actually. I think that's a really important question because actually, and the CDC came out with this last week as well. We're actually very much recommending not going out and stockpiling face masks, and for a couple different reasons. One, face masks are meant to be used if somebody is sick, to use a face mask in order to prevent spread. They are not helpful to prevent infection. So having a healthy person wearing a face mask is not going to help them from getting infected, and it will diminish the supply for people who are sick, who actually we want people then, if they're sick, to wear face masks to prevent the spread. So we are not encouraging going out and getting face masks. Now other things like hand sanitizer and tissues, okay, but it's not necessarily, we're not necessarily recommending that now. But face masks is a particularly important one because we do want face masks for people who are sick to wear them. So that is an area that we're giving guidance.
Are there preparations people need to do differently than you would prepare for, say, the flu?
So a lot of the personal hand hygiene is the same, right? So this is a respiratory virus, just like with the flu. But I think the case with this novel coronavirus is that because there is no natural immunity, we may have more people infected than we might have with the flu. So it's more of a case of preparing if there's more people infected, and therefore thinking through if you have a sick family member, let me have some contingency plans for that.
Are hospitals prepared to handle an influx of patients should that be necessary?
Yeah, again, we're working really closely with our healthcare sector to make sure that they are prepared, thinking through all of those, that planning, making sure they're thinking about their supply. So we're working really closely with them on that preparedness. And they're used to, the other thing is remember that this is, in 2009, we went through the novel H1N1 pandemic, right? And so we've gone through these infections before, and our healthcare system is very good at preparing for these kind of things, and we're working very closely with them and have been for the past month and a half to get ready.
Gary?
Mike, I want you to earn your keep today. So why are you, I'm saying it's not flippantly, why are you here, and what are some of the areas of expertise that your division can offer in these situations? And you just give a couple of examples that might come into play.
Sure. As you know, you just heard her talking about the pandemic in 2009. We were a part of that. We worked closely with public health and our other state emergency response team partners in operating a warehouse as we sent medicine out. There was a medicine available for that one, but not so for this one. So, but we understand how to provide wraparound services to the technical lead. So what I'm talking about here is we have an all hazards approach to emergencies. And in this case, public health is the technical lead for this emergency. You've heard her briefing out, so she's leading us in the response here. It's my job as the state emergency response team leader to provide her with the resources that she requires in order to be successful. So if that's transportation, logistics, supplies, resources, things like that, planning, that's what we do. And to that end, we've had several personnel embedded within the Public Health Coordinating Center. And so we have very close communications, and we're helping develop plans so that based on whatever happens, we'll be able to scale it up, scale it down quickly and aggressively. And so that's where we are.
Follow up quickly. It says here the task force is developing response plans that address a range of possible scenarios. We think a lot about your organization. Often the National Guard is called out. Are there scenarios where the Guard would provide some of this wraparound care?
Right, and so you know the National Guard is really our biggest force multiplier. That's our biggest source of manpower. And so if we had a situation where we needed a lot of supplies to be transported somewhere, or things, or some security, just whatever, communications, we would rely on our National Guard partners. They're ready to go. We've been coordinating it with them, as well as the Office of Emergency Medical Services and other agencies that are pertinent to this type of event.
I know the CDC has said it's time to start thinking about preparing. Because this is such a new virus, have they given you any indication of when we might see more cases in the United States?
Yeah, I think that's a really hard thing for us to know when, which is why we've been preparing for the past month and a half. We're preparing today, we'll prepare tomorrow. So I think it's a hard thing to say if and when. So the best thing that we can do is be as prepared as possible for today.
Right now, travel recommendations say if you traveled to China recently and start to feel some of the symptoms that you might want to get checked provider. But at what point will that spread even in some of the other affected countries that you should also be concerned about that?
Yeah, and we're communicating really closely with the CDC on that, and then when would be those changing guidelines in terms of returning travelers. So for right now, those guidelines haven't changed, but again, we're in really close communication with the CDC, and then if those guidance change, then we'll follow CDC's recommendations on that.
You had hoped to have a place in state to be able to test for the virus. Has that been set up yet? Has that been established?
So our state lab is very well prepared in order to do that testing. As some of you probably know, we did get the first test kit about maybe a week or two ago, and we were gearing up to use that. And then that test kit, we were asked to send that back to the CDC because there were some problems with that test kit. We are ready and prepared, and as soon as we get a test kit back that has been validated by the CDC, then we'll be able to do that testing here. Our lab has been really proactive in talking with other labs across the country, and with the CDC, we feel very well prepared to do that testing as soon as the kit is available. However, I would also iterate again that we have no cases. We don't have a large volume of testing. We're really close with the CDC. The CDC can do testing for us if we need. And so we don't see the lack of us being able to test in North Carolina right now as a major problem or barrier, and we're ready to have that capability as soon as we get the test kit back.
Can you walk us through a scenario when you do get the first case, when and if you do? What happens once it's been identified?
Yeah, absolutely. I think that's a really good question. So what we would be doing is that if we were testing somebody that met the criteria already, that person would have the isolation precautions, the precautions that would be put into place to limit any spread while that person was being tested, so that that person turned out to be positive already. The measures that would need to be put in place to prevent spread would already have been put into place. And then what we would do then is then go and figure out who there might be close contacts with that person, close family members, and then being able and then start monitoring those family members so that we could do any early detection if any of those contacts were to become positive, and then be sure we put in those prevention strategies for those close contacts.
Now, is there some place designated for isolation of these folks?
Yeah, so that's a really good question as well. So what we anticipate is that most people who are in isolation will be isolated at home, or if they're sick enough that they would need hospital care, they would be isolated in the hospital. But the vast majority of people in isolated or quarantine would either be at home or if they're sick in a healthcare setting. We are not anticipating having an isolation facility or anything like that. Most people would be isolated at home.
Or in a local hospital?
Yes, sir, if they were needing hospital care in the level of hospital. Yeah, and rest assured, the other thing that I want to point out is we will be ensuring that if we do have a positive, we will be proactively putting that out. So if you don't hear you have a positive, then we don't have a positive. So if we were to get a positive, we would let people know, and then we would put into place those precautions.
I just want to clarify one thing. You say there's no confirmed cases here, and also there's no one here right now that's being treated for it that may have got it, that it may have come from another state or something like that. Does that make sense?
Yeah, there's nobody in North Carolina with a confirmed case of coronavirus.
Okay.
Novel coronavirus.
Nobody being treated or living here.
There's no confirmed cases of COVID-19 in North Carolina.
If someone should suspect they have been somehow exposed and may be experiencing symptoms, what does that person do?
Yeah, that's a really great question. That's a really important piece of our strategy, right? I'm excited about public health strategy. And that's one of the pieces that high alert, a lot of our activity at this point is making sure that providers and people and travelers know what to do, right? And so if they have, travelers have traveled from China or have been in contact with somebody and then have symptoms, then we would really want that those people to either tell their healthcare provider or their local health department about their symptoms, and then we can go work with that person and with the CDC and decide if we needed testing and what we would need to put into place. So the best thing a person could do is either talk to their local health department or their healthcare providers, and those are the organizations that we've been talking with, so they would know what to do if someone were to come to them.
Is it a situation where someone should call rather than risk exposing other people in a waiting room?
Absolutely, yes. That's part of the recommendation is call ahead, because then what we want to be sure is that if you are going to a healthcare facility, we can be sure then those protections are put into place and they're not exposing other people. So absolutely, that's a great point. Yep.
Is there a certain group of people that you're looking out for that might be more susceptible to getting coronavirus, let's say health workers or people that travel frequently with airport or bus?
So I'm going to answer that, but before that, I want to take an advantage of that question to say, one of the things that we are finding is a lot of stigmatization and discrimination against our people of Asian background. So the one thing I want to say is that people of Asian background are no more at risk of getting this infection than other people. That's a really, really important piece, and we are seeing a lot of that. So that's a very important piece. Now, what would put you at more high risk, right, is that if you have a travel history to an area that has a lot of infection around, or you had contact with somebody with a known infection. Those would put you at higher risk. And then one of the things that we are, and we're working closely with our healthcare professionals are, it makes sense that if you're a healthcare professional and that you are caring for somebody who is positive, then that's a risk factor. So we're making sure that our healthcare providers then are making sure that they have the personal protective equipment, that our healthcare workers are protecting themselves. And that's one of the things as part of this preparedness activity with our healthcare providers is make sure you have those in place. Know your infection strategies so that we can be sure that healthcare workers are being protected.
Is there any concern with equipment healthcare workers need? Much of it is manufactured in China. Is there a concern with supply?
So China is a global economy, and so there are, I think, thinking through some of that supply chain is something that is on our radar. I think that's one of the beauties of our close partnership with emergency management is that they're good at supplies and logistics, and if we need to move things around, if we have scarcity in one part of the state, then we can call Mike and he can help us with some of the supplies and logistics. So it's something on our radar.
We've established a work group, and they're currently working on trying to find where we can get that type of equipment rapidly in the event that we need it. We do have some stock, but as you might imagine, if it scaled up and we had a big issue, it might be difficult, getting more, but that is one of our top priorities.
I kind of answered this question earlier, and I've had to jump in and out, and forgive me if I'm asking a question that somebody else already has. We're here for information, but we certainly don't want to create hysteria. Is this a situation where people do need to be running out and using masks? I mean, we went to some places today, we're sold out locally. Do you think that we're there yet, or it's just kind of make sure everything's okay in-house?
We are not there yet. This is again, we still consider currently the risk in North Carolina to be very low. We want people to take advantage of that low to prepare. We are not, we had a conversation about face masks we are recommending against going out and buying face masks and using face masks, especially if you are healthy. And so this is a matter of common sense approaches to prepare, but not to panic.
Folks on the phone, it would be really great, sorry to interrupt, if you guys could mute your phones. We're getting some feedback here in the room. It's kind of difficult for us to hear. So if you could mute your phones if you're not speaking, that would be terrific. And then we're going to give you guys on the phone a chance here and a few more questions to ask some questions, because I know it's hard because you're not here. So a few more questions from here.
Well, I was just going to ask, could you tell us what the symptoms are of this virus? How do you know you've got it?
Yeah. Well, you only know you've got it if you got the test. But the symptoms are similar to other respiratory infections. So fever, cough, runny nose, shortness of breath. Those are the symptoms. And then you would want to couple that with then an exposure. So either a travel history or exposure to somebody with a known disease.
Terrific. Folks on the phone. I know I heard Seth. Business Journal. Chance.
Yeah, sorry about that. I'd like to know if you mentioned advice. Oh, wow, that's feedback awful. The specific advice to businesses. What should businesses be reviewing specifically? I know you mentioned kind of telemedicine policies. Should they be at this point considering having employees work from home? What kind of considerations should employers be making?
Yeah, so a couple things in terms of guidance for business. One, in the press release, you'll see a link to the CDC website that has guidance for businesses. Some of the high-level suggestions we summarized in our press release. So for right now, again, we have no cases in North Carolina, so we are not recommending that people work from home. We're not recommending any changes in business functions right now. What we're suggesting, though, is businesses start looking at their HR policies, start looking at their policies to allow people to work from home, if that were to be a suggestion. What about leave if someone has to stay home with a sick family member? What is in terms of the HR policy? So the recommendation for businesses right now is just start reviewing your policies and see what you have in place in case there is a scenario that people need to work from home or need to stay home, but no recommendations right now of businesses doing business any differently today, but just start looking at your policies in case scenarios were to change.
Hey, Helen.
Can I ask one follow-up question?
Yeah, sure, Seth. Go ahead.
The other thing I was thinking about is, are we at a point where we're advising people to be more considerate of when they're going to the doctor and what kind of things should they be calling ahead for things other than coronavirus, I suppose the question? Should they be limiting their exposure to medical offices and trying to not inundate emergency departments?
So, so right now, again, right, we have no coronavirus in North Carolina. So in terms of that in response to coronavirus, no, but we are in the middle of flu season, right? And so a lot of thinking through, a lot of our, our providers are caring for a lot of people with flu. So again, if you don't have to be in the doctor's office, it's probably good idea to call ahead and think about doing things by telephone as you can, because we do have a fair amount of flu right now in our hospitals and our healthcare settings, but not specific to coronavirus.
Oh, thank you.
Helen from Blue Ridge Radio, Blue Ridge Public Radio. I know.
Yes, I'm calling to see what about for areas outside of big cities, in rural areas, coordination with, are you in communication? Is there sort of a check-in? I'm just trying to find things for the listeners in our area so they can understand what sort of prep efforts are underway, coordinating with the state. Thank you.
You broke up a little bit, so I think it was about preparedness. Is that right?
Yes, sorry. Preparedness. So for areas like Asheville and beyond, the western part of the state, we have one big hospital system here, but a lot of smaller county health departments. What sort of efforts are underway, or communication efforts between state health officials and local health officials, especially in rural areas?
Okay, yeah, that's a really great question. So part of our coordinating for the past month and a half, we've been in really close contact with all of our local health departments. We have a weekly call with our local health departments, and then have a monthly meeting, in-person meeting with our local health departments. So we've already been in very, very close communication with all 85 of our local health departments across the state, as well as our healthcare systems and our hospitals. Regardless of where they are in the state, we've been really close contact with them, especially, again, our local health departments.
I'd also add that we're also having conference calls with the local emergency managers across the state to make sure that they are staying up to date on the preparedness efforts for COVID-19.
What kind of support would be in place for schools that would, if they were unable to have students in the classes? I know when I talked to one superintendent, he said that not every student, most of them, but not every student had internet connection or phone service or a device to use. So what would it look like for support for those students?
Yeah, I think that's from some scenarios as we think about that. We'll be fleshing out some of those scenarios in the scenario planning, and then engaging the Department of Public Instruction and our schools to start thinking through what that would look like. That's part of the forward-thinking work that we'll be doing with the task force and engaging some key stakeholders.
Anybody else? On the phone, anybody else?
Paul Johnson of the High Point Enterprise newspaper.
Hi, Paul.
Hey, how are you?
Good.
Can I ask a question, or someone else in the queue before me?
Please ask a question.
Okay, great. Hey, I have a question about this. Is hypothetical, but I hope y'all can answer it. Who would have the ultimate authority, either state or federal or county, to cancel a public event because of the coronavirus threat. In other words, to say you can't hold this event that's going to draw a certain number of people to a location because of the public health threat.
Yeah, the governor would have the authority to do things like canceling of mass events. The governor would have the authority to do that.
Governor Cooper would have the authority to make that decision.
Yes, sir.
Okay. All right. Thank you very much. I know you've had a lot of media calls. Appreciate you taking mine.
Thanks, Paul.
Thank you.
Thank you. Thanks, everybody on the phone. Anybody else here in the room?
So, Rose Tobin from North Carolina Health. What about colleges? How are you, working with colleges, and what do those emergency plans look like?
Yeah. And so as we talked about some of our key stakeholders, we think about education. That'll be both preschool, K through 12, and colleges. There are already some guidance with colleges, but that's a key stakeholder that we'll be bringing into the fold as we think through, as part of our task force planning and thinking through our stakeholders that we we'll be working with those colleges and universities. We've already had some conversations with our UNC system and across all those campuses, so we've been having that conversation, and so we'll be doing that a little bit more formally and planning as part of that, and also be putting out some guidance geared directly towards our educational facilities from colleges all the way down to pre-K.
All right.
All right.
Thanks, everybody. Thank you, everybody.
Thank you very much.
Yep. Thank you.
All right. Bye-bye.
Thank you.
Really? You did it great. I mean, very natural.